My name is Erin Murphy, and I am the chair of the Committee on Public Health, Homelessness, and Recovery. I want to remind you that this public hearing is being recorded and broadcasted live on Xfinity 8, RCN 82, and FiOS 964, and streamed on www.boston.gov/city-council-TV. Please silence your cell phones and other devices. We will also take public testimony and would appreciate it if you sign in to testify or to register your attendance. If you do, I don't think there's anyone here who wants to testify, but if you do, you sign in on the form that's in the corner over there. Today's hearing is on docket 0964. This matter is sponsored by me, Councilor Murphy, and Councilor Frank Baker, and was referred to the Committee on Public Health, Homelessness, and Recovery on August 10th, 2022. I will read the docket summary here. This is an order for a hearing to address the monkeypox virus and the city's strategy for the breakout. I am joined by my colleagues, Council President Ed Flynn. Thank you, Council President Flynn. I will start with opening statements, and then I will pass it off to Council President Flynn for his opening statements. Last month, on August 4th, the federal government declared a public health emergency against the monkeypox virus to bolster the response to the outbreak, which would free up money and other resources to fight the virus. There have been 409 confirmed monkeypox cases in the state since the state's first case was announced in mid-May. Vaccination efforts nationwide have been criticized as slow and lackluster. The federal government said it had limited supply of the Genius vaccine in its stockpile. It should be noted that the virus is not unique to the LGBTQ+ community, and these individuals shall not be stigmatized for it. The nature of monkeypox's close contact spread has led to a disproportionate impact on such individuals in our LGBTQ+ community. The COVID-19 pandemic is still not over, with the highly transmittable BA.5 Omicron subvariant lurking. Boston must be prepared to handle two public health threats simultaneously. The City Council should be up to date with all available information regarding monkeypox in order to best protect and educate their constituents. We learned many lessons dealing with COVID-19 over the past 2 years. So now is the time to implement what worked and become a role model for other cities on how to deal with a public health threat. With this said, my objective for this hearing is to discuss the strategy for the city against monkeypox, including preventive steps, availability, access to testing and vaccinations, treatment, increasing knowledge and awareness of the virus to schools, families, and all of our residents. We do in our office, and I believe other councilors also, get a lot of calls and emails from concerned teachers and students, parents of students in schools, knowing that we just are kind of coming out of the COVID-19 pandemic. So before I pass it off to Councilor Flynn, I do, you are Dr. Sanchez? Yes, so welcome. From the Boston Public Health Commission, Infectious Disease Bureau, thank you for being here. We did invite Denny Lobo-Lopes, who is the Senior Director of Health Services for the Boston Public Schools. She is not here. And then we, Quincy Roberts, who is the Senior Executive, or he's the Executive Director of the LGBTQ+ Advancement Office. Thank you, I know you are here in his place, yes. So with that being said, I'm going to pass it to Council President Flynn.
Thank you, Madam Chair. Thank you for bringing this important issue to the City Council and to the public. Thank you to the panelists also for being here, for the important work you're doing on this issue. When monkeypox first appeared, I had the opportunity to coordinate several meetings with my City Council colleagues, and we had a we had a meeting to discuss monkeypox and the impact it's having across the city, especially in including the LGBTQ community. And we also addressed the importance of addressing this as a public health and making sure that we address stigma and misinformation head-on in social media. And someone I worked with closely was Quincy Roberts, too, who did an outstanding job working with me, not on just this issue, but on many other issues. As I mentioned, I represent a large LGBTQ community, and he's been very invaluable to the conversation through his professionalism and knowledge. So I'm here to continue to learn more about this, learn more about what the city's plan is and how we're providing the best medical care and coverage we possibly can to residents. I'm also here to learn more about prevention, also addressing stigma and misinformation, and making sure that we treat this as a public health challenge, major challenge. So again, thank you, Madam Chair, for the important work you're doing on this issue. Thank you.
Thank you. Thank you. So we can start with the Equity Department. You can start. Thank you.
It's okay if I just Good morning, everyone. My name is Maria Angeli Solis Silvera. I'm the Chief of Equity and Inclusion and I oversee multiple departments, including the Office of LGBTQ Advancement. And Edie Roberts couldn't be here today, but him and I worked very closely on this the moment that he was announced as our new executive director of the inaugural office. So I'm very well versed in what he's been up to. And I want to thank you both, councilors, for acknowledging the impact that this has had in the LGBT community and how we want to move away from any language that stigmatizes people who have already experienced multiple pandemics. And so back in June, Dr. Ojukutu and I hopped on a phone call, and we were like, we want to make sure that whatever the outreach, whatever the work and engagement is going to be, there has to be a direct engagement with the LGBTQ community, because we cannot be left behind. I too am part of the LGBTQ community, and so we could not be left as an afterthought. And so the moment BPHC was able to do a lot more of the data collection and get ready to share more information, we did our first town hall in July 26th. Our target audience, because we made a couple of phone calls, we spoke with Fenway Health, we spoke with a couple of the different party promoters, club owners, etc. We decided that the target audience first should be those people. And so we invited some of the community health centers as well as different bar promoters and party promoters. And it was very well attended. We had more than 50 people there. And actually Dr. Sanchez was the one that just did a basic 101, what is monkeypox, how do we keep our community safe? From that, the feedback was loud and clear that they wanted to make sure that we continued the conversation so that it doesn't turn into something that 6 months ahead we look back and say, oh, we didn't do enough. And so from that town hall, a street team was developed, and that was actually fully an idea from the community. And it was over 5 people, up to I think 8 people from the town hall just got together and helped BPHC as well as Quincy Roberts hand out the different flyers and QR codes to the different bars that we know a lot of our community members frequent. And after that, there was another town hall on the 29th, more open to different folks, especially Black and Brown community members in the LGBTQ spaces. We had another one in around the time of back to school with local colleges and universities, where BPHC was the main lead there. And we had over 70 colleges and universities. And one thing that we want to highlight is, since we started working with BPHC and really targeting the LGBTQ community. We had one of the first vaccine clinics. I remember Quincy was like 30 people showed up and only one person was Black. And after all of the work that he's been doing on the ground with community members and with the support of BPHC, he was able to organize with partners another vaccine clinic, and there was just it was a clear moment of why it's necessary to have the different departments that we have. He was able to get more than, I believe, 20 people vaccinated and all identify as members of the BIPOC community within the LGBTQ spaces. And so we're gonna keep working. That was his main priority all throughout August, and now we're shifting because we know that BPHC has just been doing a wonderful job and is gonna continue doing the work, and we're partners in this. But just wanted to sort of give you an overview of what that particular office has been focused on and what we are hoping to continue to do. Thank you.
Thank you. Go ahead, thanks.
Good morning, everyone. I'm Dr. Sari Sanchez. I'm the Medical Director for the Infectious Disease Bureau at the Boston Public Health Commission, and I'll be speaking a little bit about monkeypox and some of the characteristics that underlie clinical and others that underlie our efforts, as well as some of our partnerships, as mentioned. I do have slides. I'm trying to see if thank you. Perfect. Next slide, please. So just to talk a little bit about monkeypox. Monkeypox is a viral infection, and it is caused by infection with the monkeypox virus. It is a disease that often can begin with flu-like symptoms that are then followed by the classic rash. And that is really the symptom that most people develop, is a rash that can look like pimples, sores, scabs. It really can be present at any point in the body or throughout. With this outbreak, we've particularly seen a lot of genital lesions, but they can be in other parts of the body, including the arms, legs, and face. And it is really these scabs, these rashes that have the most virus and that are the most infectious. And so really, as we think about transmission, it really is sort of through particularly contact with the rash that people often can get infected. Now, the rash can take anywhere from 7 to 14 days to scab off and heal completely. And that's important to know because that is when people are considered to be infectious. And monkeypox is a reportable disease, meaning that it requires for people to isolate for this time period while they are infectious at home to avoid infecting others. While most people recover completely, the rash can be painful, it can be severe at times, and as we all know, prolonged isolation can carry significant mental health, emotional aspects for individual health, as well as for organizations having to think through absenteeism, among other sort of public health concerns. And as highlighted, the rash can often be stigmatizing, the disease has been stigmatized, and we have been working very closely to avoid stigma and reach our vulnerable communities. Next slide, please. So, as mentioned, monkeypox virus is most commonly transmitted through direct skin-to-skin contact with the infected lesions, scabs, or body fluids. It can also spread less commonly through indirect contact, and that can include clothing and other surfaces that have been in very close contact with the scabs, rashes, and very much less commonly through respiratory droplets, very prolonged face-to-face contact. But really what we've seen with this outbreak is primarily the first, direct skin-to-skin contact. Next slide, please. So globally, as of last week, we've had over 70,000 cases. We've had over 25,000 cases in the United States. As mentioned previously by Councilor Murphy, we've had 409 cases in Massachusetts, and we've had around over 150 cases in Boston. We've had 2 deaths in the United States. Next slide, please. So I want to sort of talk a little bit about the data of the impact of monkeypox in the city of Boston. So this was an analysis that we published on the BPHC website, highlighting the cases that were reported from June to September. And we had a total of 146 cases of, we say confirmed and probable cases, and that's really due to the type of lab testing. But these are 146 cases of monkeypox virus that were reported. Our first case was reported in June in Boston, And when you see here pictured is a graph highlighting the number of cases per week across all the different weeks in this time period. And you'll note that most cases really occurred in July, sort of the week of July 20th to July 26th, we had 23 cases, and we've seen cases steadily decline thereafter and really sort of come down, which has been reassuring. Next slide, please. Now, when we look at more closely at the demographic characteristics of our cases, we see that white, non-Hispanic, and Hispanic individuals really do comprise the majority of cases, 42% and 30% respectively. We've also been very closely monitoring the impact by neighborhood as we have with COVID and other diseases. And we've noted that Dorchester particularly has the highest amount of cases with 32 cases, followed by the South End neighborhood that has had 18 cases. And then sort of pictured are other neighborhoods that we've seen impact, including East Boston and others. Neighborhoods that are not pictured are neighborhoods that have less than 5 cases, including Hyde Park, West Roxbury, Charlestown, and South Boston. Next slide, please. So, as mentioned, there is treatment for monkeypox, and there's treatment for smallpox that has been used for monkeypox, and that is called tecovirimat or TPOXX. Now, this is an antiviral treatment that is under an investigational new drug permit that's being allowed for treatment of monkeypox as we learn more and acquire more data about its effectiveness in monkeypox specifically. And we've been looking very closely to try to ensure that access to this drug is equitable and sort of making sure that individuals have access to information. And so out of our 146 cases, 62 have been treated with TPOXX. Now, I will add that not everyone is considered often eligible for TPOXX. This drug has often been, clinicians have been instructed to use in the setting of lesions that are considered to be more disseminated, to be in high-risk areas, or individuals who are immunocompromised. However, high-risk areas often include genital and anal lesions, and we know that those have been quite common in this outbreak. So many cases likely would have qualified per our understanding. Now, what we've seen is that treatment has been occurring almost evenly by race and ethnicity, but we've been keeping a particularly close eye on access by neighborhood as well, since we know that geographic access is critical. And I will note that in terms of looking at some of our race and ethnicity numbers, we note that Black and non-Hispanic individuals have received a high amount of treatment, and that white and non-Hispanic individuals, as well as Hispanic individuals, have followed closely thereafter with 47 and 43% of uptake. We did also note that uptake increased across time as well. Next slide, please. And what we did have, however, note is that treatment has not been occurring as consistently by neighborhood. And that's a little bit of what we're trying to delve into and analyze a little bit more closely. But as I mentioned, Dorchester had the highest number of cases at 32 cases. And despite that, only 11 of those cases received treatment. Again, we are still analyzing this data quite closely to analyze the time and sort of the weeks that these cases might have been diagnosed, because we do know that uptake increased by time. However, we also know that, again, geographic access is critical, and we continue to partner with healthcare providers in the area. And we actually hosted a provider call with City of Boston healthcare providers towards the end of August. Next slide. So oftentimes if individuals have symptoms of monkeypox, I think we've centered our education efforts in a few key categories: prevention, how to educate individuals about what to do if they have symptoms, and sort of treatment and outbreak response. So we've really honed some of our education efforts on the fact that it really is critical for people to stay home and isolate if they have symptoms. That way they can avoid infecting others, and importantly also access treatment, as I mentioned, which can be of benefit. So that's mostly what we have been focusing our education on our website and on our materials is: if you have a new unexplained rash, avoid contact with others, and seek healthcare guidance. Next slide, please. As I mentioned, treatment is available, and we've also been trying really sort of providing different information on our website in a multilingual form to ensure that people have knowledge about treatment and ask their healthcare providers if they are eligible. Next slide, please. So one of our key efforts, as mentioned previously, has been that transmission can be prevented through vaccination, and that is in a few key ways. One, individuals who are vaccinated, even after they're exposed, especially if it's closely after their exposure, vaccine can prevent infection, and that's called post-exposure prophylaxis. Now, that has been the main public health strategy supported by the federal government in the past months, and really trying to reach with vaccination individuals who have been knowingly exposed, have known contacts in the household, known close contacts, sexual contacts, or those who believe that they might be at risk for contact, either individuals who have been sexually active in the past 2 weeks in sort of a jurisdiction with known monkeypox. So that has been the primary two categories under which individuals have been eligible for vaccination. And then recently the CDC has expanded that criteria to now include more efforts around pre-exposure vaccination due to increased supply of vaccination. And so this is actually quite recent in the past 2 weeks, and will be an ongoing area where BPHC will continue to collaborate with agencies to ensure that there is education for our communities on when they are eligible. So for example, this includes individuals who have are living with HIV, have had a diagnosis of a sexually transmitted illness, have recently had more than one sex partner, or individuals who have been attending certain private activities or sort of activities that might have been linked to a case with monkeypox. So again, really trying to expand vaccination criteria. Next slide, please. So we've also been working closely to identify and provide information about vaccination sites in Boston. So the sites that mainly currently are operating include Boston Medical Center, Codman Square Health Center, East Boston Neighborhood Health Center, Fenway Health, the MGH Sexual Health Clinic, and we've also been partnering with Health Innovations to provide vaccinations either after, for example, if we as a public health agency have identified known contacts of someone with monkeypox, and we've provided vaccine to a certain group if there are more than one individual, or at-home vaccinations for families and others who are impacted by a case of monkeypox in the home. So they have been important partners in collaboration with the Massachusetts Department of Public Health. Next slide, please. There are other ways that we have focused our education efforts in terms of prevention, and a lot of this really comes to information about core communicable disease prevention. So, things like hand hygiene, individuals staying home if they feel sick to avoid infecting others, avoid touching anyone with a rash or sore, or educating around individuals who might have to cover a rash if they cannot isolate from others or need to go to a healthcare provider or live in multi-generational or crowded housing with others around mitigating spread to the home. Cleaning and disinfecting high-touch surfaces. This has been a critical part of many organizations' COVID-19 mitigation efforts. And so really sort of building on the systems that we have built with COVID, I think, is really critical here, and thinking about it as large, again, communicable disease prevention. Next slide, please. So again, I think our public health response has been multifaceted, and I think a really important, we as a public health agency, one of our core roles is to perform case investigations. And so all individuals of City of Boston residents that have been diagnosed with monkeypox have been called by the Boston Public Health Commission's public health nurses on a day-to-day basis to check in on symptoms, to provide support, which has actually been quite critical, again, as we think about prolonged isolation, and to sort of connect to healthcare services, including treatment, as well as to connect their contacts to vaccination. So that has been one of our core efforts. However, I think that our health education efforts really have been enriched by our partnerships with other city agencies, including Boston Public Schools, and sort of including our Office of LGBTQ+ Advancement, to really reach our communities that are being impacted and provide education and access and to resources, including vaccination. And so I think I'll talk a little bit more about that as I think a lesson learned as we think about how to build on additional infectious disease threats. Next slide, please. So on our website, one of our other kind of really guiding values as we think about health equity has been to ensure that we have multilingual health education materials. So our fact sheets are available in the 9 Boston languages. And really, we have several infographics on prevention, as well as information on vaccine and some of the data that I presented. And this is all available in a multilingual form, which again is critical as we think about the fact that this has particularly impacted Hispanic and other sort of communities of color here in Boston. Next slide. So again, just a little bit of, our work on addressing stigma and misinformation, again, through our partnerships as well as like through our resources. Next slide, please. Where our resources are available at boston.gov/monkeypox in the languages I mentioned. Next slide, please. And actually, sort of one of our efforts that I believe was mentioned is, we actually designed coasters that have a QR code where people can scan the QR code and we'll take them to our website, which again includes information about vaccine locations. And so this has been distributed to vendors across the city as again an innovative and collaborative partnership to really directly reach our LGBTQ plus bar and club venues. Next slide, please. And, I think as the coasters are really in addition to other calls that we've hosted with school, school nurses. I actually spoke at sort of BPS opening health services day to our school nurses around monkeypox. We also provided a session to our early education centers, information session on monkeypox and how to support families or think about education if there isn't a reported case, as well as our colleges. And so again, I think one of the critical lessons learned is the importance of innovative partnerships, the need for ongoing multilingual health education resources, and importantly, really thinking about accessible sexual health and communicable disease prevention services across the city and how critical it really has been as we think about health equity. So I believe that was my last slide, and I welcome questions and thank you for your attention.
Thank you. Thank you for that. It's informative. So I do have a couple questions. I was going to ask the equity question first, if that's okay. So I have a feeling to some of these, but knowing that, I'm not in that community as much, say, as you directly or Quincy and others. So wondering if the stigma associated with it, has the name at all impacted the community, or the stigma associated with it? And if there's other things, I know you talked about some great outreach with the community, and Quincy has that street team developed, like wondering how we can help, or our office can help make sure that we're getting out into the right communities and the right places to give them the information needed, or if they're already infected or concerned about it, that we can lead them to the right places, because there's lots of supports out there. And you mentioned many of the healthcare centers, which Council President Flynn, we were talking earlier about, like Fenway Health and South End and East Boston Health Center do amazing jobs. So making sure whatever resources they have connecting to the community.
I think
it will go.
There we go.
Yeah.
That's I would say that at the beginning, there was, because there wasn't enough information out there. And I'm talking about like March or April, before we even saw our first case here in Massachusetts. Yes, I think there was just a lot of misinformation or lack of information and not really understanding where this was coming from. And in spaces, especially thinking of our the older communities within the LGBTQ spaces, we're concerned, right? Which is why immediately we reached out to BPHC, because we wanted to make sure this was at the center of whatever form of engagement or work that was going to happen. I will say, we're trying to follow the data, right? Like if we're seeing positive numbers. Well, I guess you get the point. And when I think the biggest thing is if hopefully not, but if we do see another surge, it would just be a matter of like us reaching out to you so that you can help us ensuring that we're getting the word out. But I would say that the community informed the engagement strategy, and it was very effective. And we have a lot more work to do, obviously, but I'll end at that.
Thank you. You had mentioned that you've expanded the vaccination criteria. Is there, so it seems like it's not openly available. Is there a shortage or a concern for a shortage, so you have to kind of meet certain criteria still to get vaccinated?
Yes, so the vaccine criteria are set forth by the CDC based on supply as a federal strategy, and then states then operationalize that strategy and sort of implement those criteria. So the Massachusetts Department of Public Health has been receiving JYNNEOS vaccine and recently also updated their website and eligibility criteria to reflect the CDC recommendations now that we have more supply. I do think, I think this is really critical because even though cases are coming down, I do think that what we continue to see, I think still vaccination uptake is not, is not necessarily equitable. And I think oftentimes, I was just reading even today that, we see other countries that are also seeing monkeypox cases, and we have many travelers and many individuals who travel to home countries and come back to Boston, and particularly in our immigrant communities. And so I do think that with this expanded criteria, I'm looking to collaborate more with providers to think about how to integrate vaccination within other services. We know that many people, it's hard to just come for one appointment to get vaccinated, and actually it's 2 shots with JYNNEOS. And so I think I think it'll be more an issue around making sure that people know that they're eligible, and really weaving this with other services so that we don't miss opportunities to vaccinate individuals who are at risk. I think those are going to be some of the critical challenges moving forward.
Thank you. Council President Sloan?
Thank you, Madam Chair, and again, thank you to the panel. I know at the beginning when monkeypox first appeared and then it was also reported in the public, in the media also, there was some perception that Boston and many other cities as well, including the federal government, were not as prepared for the virus as we should have been. Is that accurate, Doctor, and what could we have done differently?
Let me think about that a little bit. I think all things considered, here in Massachusetts and Boston, within Massachusetts, we do have a fairly robust infrastructure when it comes to not only sort of access to health services through sort of our insurance systems, but also, education and information. I think, definitely, the emergence of monkeypox was unexpected. I don't think, we have seen monkeypox in other countries for years and certainly had never seen a global outbreak like we did. And I think one of the challenges was really leveraging vaccine early enough, and that really is sort of an issue not just here but nationally. Sort of thinking about how we leverage a resource in a way that it reaches sort of the most impacted populations, but also to minimize a stigma. And I think those were some of the challenges that I think we faced. And I think that a part of the preparedness really is sort of being able to not only offer vaccination, but also offer vaccination strategically across locations. And I do think that a part of the work that lies ahead for us as we move forward from this is thinking in the future how we're able to leverage vaccine more quickly in some of these neighborhoods. I do think that's an area that we can improve upon, including the Dorchester neighborhood, for example, that came up in our sort of city hall session, in our sort of town hall session, was, there aren't enough vaccine information or access to our communities of color. So I do think that's an area that we can improve upon.
Yeah, thank you, Doctor. And I attended every town hall meeting and every meeting the public health department had on monkeypox, so I learned as much as I could on this, and I appreciate you being upfront and direct with us that we could have had a better approach, not to say our approach was inaccurate or wrong, but we could have been doing a little more. But I come to these meetings not to put people on the spot, but to figure out what went well and what didn't go well, and what didn't go well, how can we make changes so the next time it does happen or there is some type of similar situation, how we can do lessons learned, basically. I served 25 years in the military overseas, and after every assignment we always do a lessons learned, and we study what went well and what didn't go well, so we can improve on the next phase. So I appreciate your honesty. So how are we doing now with, I know Councilor Murphy addressed this, but how are we doing now in terms of providing potentially impacted residents with the needed public education, public health guidelines or information to residents in various languages, especially hard to reach communities?
So in the past months, we have partnered with other city agencies. So I think one of our key strategies has been multifold. One, making sure that they're available on our website, but two, also really thinking about how we disseminate, make sure that that information people know is there. And so I think that's where some of the calls that we've done with schools, with early education providers, with colleges. The college one was actually it was over like 120 attendees from different colleges. And that was a really important one for us in Boston because we know that we have a lot of young individuals coming in and that it is a congregate setting that actually, can be source of other communicable disease outbreaks. So we've hosted calls with sort of those partners and provided information via those materials. And also disseminated the coasters that we referenced. One of the campaigns that we're currently finalizing is also a campaign for dating apps to be able to provide some of this information via QR code. And so we have 2 ads that are currently being approved, and we're very excited to be able to launch. And finally, I think through news and media outlets, I've been on Spanish-speaking news outlets and others. But, I think part of the reason why I mentioned our partners are so critical is that, it is really general, not just, targeted or focused education on our LGBTQ plus community, but really thinking about schools, families, and sort of our overall communities and how through trusted partners, we can sort of get the information there. So that has been, some of our past strategies. And I do think now with the expanded eligibility criteria, and part of your question, Councillor Flynn, is really trying to engage more with our providers directly to make sure that they have the tools and the resources to be able to offer vaccines and sort of education. This is a time when healthcare institutions are so taxed with COVID, with other flu and others. So I think those ongoing conversations are really going to be critical moving forward.
Do we have enough vaccines now for people that need it? And was there a period of time that we didn't have enough vaccines for people that could have come in and got the vaccine?
At the beginning, when the Massachusetts Department of Public Health first received vaccine, and prior to it being able to be administered in a different way, the intradermal sort of technique that allowed for more vaccine from a vial, there was a limited supply. And I do think that was a limiting factor for many in terms of calling to get an appointment. And so we did work, at least throughout the first few weeks, with a limited supply. MDPH continues to directly receive the supply. Our understanding is that supply has not been as much of an issue in the past weeks, and that really I think more of the challenge now is just making sure that individuals are coming to get vaccinated, especially as we think about now booster COVID-19 vaccines and flu. It's a lot, trying to make sure that individuals prioritize this as well if they are at risk.
Thank you, Doctor. Thank you, Madam Chair.
Thank you. I just have a follow-up from that. Yesterday, I think it was yesterday, you had a very effective multi-shot clinic, which had the COVID testing, COVID vaccine, and then also the flu shot. And wondering, and you had just talked about that, is it possible to, at those multi-shot clinics, maybe include the monkeypox vaccination also?
So it could be. We've talked to our partners at MDPH. Often are sort of the ones who receive the vaccine directly. We've partnered with Health Innovations, which is one of the vendors that they've utilized to provide vaccines. So for example, we had a case that had multiple contacts, quite a few, and we had Health Innovations come directly. So I do believe we can envision potentially a scenario where we offer those vaccines as well in conjunction with our state partners.
And just one thing about the numbers in Dorchester, do you think that's because it's just much bigger than the other neighborhoods and it's more populated, or are we seeing, did we compare the numbers by population? Is it?
So we don't have that data there, but a large part of my sense has been, I mean, Dorchester is, as you mentioned, one of our large neighborhood, and we often see higher numbers. That being said, you know, it really has been the majority, like nearly a quarter, or actually nearly a quarter of our cases. And so I do think a piece of this might be that we know that it is a community of color. We have sort of significant number of LGBTQ plus individuals that have, you know, that seek services there. And so I do think that while it has a high population number, I don't think that's just it either.
Just it.
Yeah.
Do you work at all with Kearney Hospital? I know you work closely with the health centers in the neighborhood, but.
So we work with Kearney Hospital on COVID-19 related efforts, mostly, but we've also actually had sessions where we provide information on monkeypox, but we haven't worked directly in terms of healthcare coordination.
Thank you.
Sure.
Councilor Flynn, do you have any closing statements before I do? No?
No, I don't. Thank you, Madam Chair.
And did either of you want to say anything before I closing statements?
Thank you.
Good. Okay.
Thank you.
Well, thank you for coming today. Before, I don't think, but is there any public testimony online? There is not. Thank you. Just want to make sure. Thank you for coming today and answering our questions. I do want to say that this docket will stay in committee. We're going to schedule another hearing. I did hear you say a few times how you have a partnership with BPS. You're providing the education and access to resources. You also mentioned that it's not just an LGBTQ, that it's schools also that you're working with, that you met with the school nurses, and also the early childhood educators to help also with questions that families have support. So we're going to keep this docket in committee, and we will schedule another meeting, and hopefully BPS can be here and others, and maybe some of the community centers as we go forward. But I do want to say that thank you for being here, and this meeting is adjourned. Thank you.
Thank you.